Rktpt, it's a bleeding disorders. All the bleeding disorders which are mentioned in modern system, which comes under the broad aspect of Rktpt. It is mentioned in Brihatrayis, and while considering the mythological description of origin, according to the mythological description of origin of disease, Rktavita appeared after Jwara because of the heating effect of later. Rktavita is a serious disease and it affects the patient with great speed like fire that we call it as Agnivat Shighrakaricha. It manifests itself and affects instantaneously. In this disease, where the blood or recta is vitiated by pitta, flows out of the openings of the body through the seven openings in the upper part of the body and through the three openings in the lower part. It is known as Mahagadam, Mahavegam, Agnivat, Shighrakaricha, which is mentioned in Charaka Samhita. While moving to the definition, what is the definition of Rektabita? Samyogat, Dushanat, Samanyat, Gandhavarnayoho, Rektapittam Rektabittam Manishipihi. Samyogat, Dushanat, Samanyat, Gandhavarnayoho. What is Samyogat? Which we can understand from the Nirukti of Rektabita. Rektayuktam, Pittam, Rektavitam. It is one of the Nirukti. Rektayuktam, Pittam, Rektavitam. That means its combination with Rekta. Dushanat, Rekte Dushe Pittam. It's vitiation of Rekta. And Samanyat Gandhavarnayoho. Rektavat Pittam, Rektavitam. Its similarity in respect of smell and color of Rekta. In Charaka Samhita, Nidhanasthanam, there mentions another term as a synonym for Rektabita is Lohita Pitta. In the living beings, the channels of circulation or the Rektavaha Srotas are controlled by Pliha and Yagrit. In Rektabita, we know Rekta is vitiated by Pitta. So, Pliha and Yagrit are the locations of Rektabita. Then, moving to the Nidhanam, like every disease, there are three factors which influence in the Nidhana. Ahara Nidhanam and some Viharas and Manasika also. Ahara, Rasa, excessive consumption of diet that are Amla, sour, or Kadu, Panjan, Lavana, saline. These rasas will aggravate pitta and cause rektapitta, and the guna like intake of excessive vidahi, improper digestion leading to burning sensation of food. Tikshna, that is sharp, or ushna and kshara. These qualities of ahara work as a nidana for rektapitta. Then vihara. Vihara, one is adapam, excessive exposure to heat of sun. Vyayamam, excessive physical exercise. Vyavayam, excessive indulgence in sexual activities. And adva, excessive walking. And manasika factors like excessive grief and anger also causes rektabita. While considering the pathogenesis, because of the causative factors which I mentioned above, pitta get excited and reaches recta, and pitta takes origin from recta, that we know. Therefore, when it reaches recta and vitiates the later, pitta get further aggravated. Once again I will explain. We all know pitta takes origin from recta. Pitta aggravated by the above said nidhanas and leaves its sites and reaches blood. This aggravation actually occurs in our koshtam because of our improper ahara or improper vihara or some manasika factors. Then, being a mala of rekta, the pitta on getting mixed with rekta attains quantitative increase. It will increase in the quantity. Then the pitta in turn vitiates rekta. Due to the heat of pitta, the dravadadu or the liquid portion of other tissues like mamsa, medas, etc. oozes out of their respective tissues and get mixed with recta. This further enhances the quantity of blood flowing in the blood vessels, creating immense pressure in the blood vessels. Due to the pressure of the blood and heat of pitta, the walls of blood vessels get damaged and the blood starts flowing through various openings of the body. Bleeding occurs through mouth, nose, ears, skin, anus, penis, and vagina. This bleeding of blood vitiated by pitta through various orifices of the body is called Rktpt. So once again, I will explain the pathogenesis. Uh, we have to know or we should know the samprapti in detail because samprapti vikhadanameva chikitsa. प्रधानस्थानात् आमाशयरूपात् पित्तसेह रक्तगमनं ज्ञेयम्. So first vitiation of pitta occurs in the amashya. So many sites of pitta are there like bile, blood, sweat, amashayam and lymph, in which in the amashya the vitiation of pitta occurs. Yonitvat, swayonitvat, vardhade, then pradushayan, that means it vitiates blood. The ushma of pitta increases the drava part of other dharus and this further increases pitta in quantity. Then in the samprapti, there are two terms which is explained in Charaka Samhita, Anubandhya dosha and Anubandha dosha. What is Anubandhya dosha? Anubandhya dosha is primary causative factor and Anubandha dosha is secondary. Anubandhya is primary, which is capable of manifesting its signs and symptoms. We classify it as Vadika Rektavitam, Paitika is already there, then Kabaja Rektavitam, etc. Then Anubandha dosha is secondary. Doshas become associated in Marga. Then Purvarupam. In the Purvarupam, there is Anannabhilasha, loss of interest in food. Bhuktasya Vidahitvam or burning, very quick digestion of the consumed food. Shukta Amla Udgaram, sour belching or belching having the taste of fermented liquid. Initially, the patient experiences the symptoms. That is, he may not have interest in food or he have a belching sensation or burning in the stomach. Then Swarabedham, fierceness of voice, Paridaham, that is feeling of burning sensation in the body. Then Klam, fatigue. Shiro Gauravam is the heaviness of head. Kasam, Shwasam, Brahmam, etc. all comes under Purvarupa. While moving to the Ashtanga Hridayam Nidhanasthanam, there are two main important Purvarupas are extra explained, like Loha Lohida Matsyama Gandhatvam and Neela Lohida Varnanam Avivechanam. Difficulty to differentiate the colors. Swapne Tadvarna Darshitvam. The types of Rktpt or the Bheda, based on the dosha predominance, we can classify it as Vadikam, Paitikam, Kabajam, Sannipadikam, Vadapaitikam, Pitta Kabajam and Kabavadajam. But the classification based on the direction of bleeding is more important than based on dosha predominance, because we are treating Rktpt according to its gati, that means its direction. Based on the direction of bleeding, it is classified as urdhvaga, adhoga, and ubhayaga. Specific signs and symptoms. Signs and symptoms manifested because of the association of different doshas in the disease are described. This is already I explained, but I am clarifying it. In the Samanya Samprapti, that is general pathogenesis of the disease, Pitta is responsible for the manifestation of Raktapitta. After the Samanya Samprapti is manifested, it gets associated with Kapha, etc. in the Vishishta Samprapti. At that time, it gives up the signs and symptoms of Pitta and gets involved with the signs and symptoms of Kapha or the dosha which is associated with it. Then dosha become associated in the marga or the track or in the channel, do not manifest their signs and symptoms. Therefore, they are called anubandhya, which we already discussed, anubandhya dosha and anubandha dosha. Then in the classification, there is Kabhaja Rektabittam. Kabhaja Rektabittam, I will explain the symptoms. Kabhaja Rektabita is Sandram, Sapandum, Sasneham, Pichilam, which is dense, pale yellow, unctuous, and slime. Vadiga Rektabittam, which is Shyavarunam, Sabhenam, Chetanu, and Ruksham. Paitiga Rektabittam, Kashayabam, Krishnam, Gomutra Sanibham. Mechakagara, Dhumabam, Anjanabham cha. Just note the specific points only. That is Kabhaja Rektavittam, Sandram, Sapandum, Sasneham, and Vadigam. The color will change. Shyavarunam. And in Paitigam, which is Kashayabham, Krishnam, Gomutra Sannibham. Mechakagara, Dhumabam, Anjanabham. What is Mechakabham? When a black cloth is impregnated with preparations of sulfur, etc., by which it becomes smooth and greasy, the color that is manifested is called mechaka. And there is one more type is there, fourth one, the Sannipadika. In Sannipadika, when vitiated by all the three doshas, the signs and symptoms of all three doshas are manifested in blood. Next is prognosis. Sadhya Sadhita. The Raktapitta is associated with one dosha. That is, one dosha is sadhyam or curable. Two doshas is krichra sadhyam or yapyam. And all the three doshas are involved, then it is asadhyam. In Ashtanga Hridayam, Chikilsa Sthanam, the chapter Raktapitta Chikilsa starts from prognosis, because when a patient comes with bleeding disorder, we have to know the prognosis of the disease. Based on the prognosis, we will start our treatment. Ekadoshanukam sadhyam, dvidosham yapyam uchyate. Yes tridosham asadhyam, tat mandhagnir adivegavad. Vyadibhihi kshinadehasya vruddhasya anashnadasya yad. Adivegavat means acute attack. So in this Urdhvaka Raktapitam, Urdhvaka Raktapitam is Kabhanubandhi is Sadhyam, Adogam, which is Vadanubandhi is Yapyam, and Ubhayam, which is Vada Kabhanubandhi is Asadhyam. It also becomes Asadhyam in the following conditions. If the patient is having Mandagni, that is less power of digestion and metabolism. And Adivegavat, if the disease is and has an acute attack, if the patient is emaciated by the disease, Kshina Deha, that means if the patient is debilitated, or Vriddha or aged patient, Anashna, if the patient is not able to eat, when the bleeding takes place in excess through either of Urdhva or Adhomarga. And there are a lot of situation in which it is incurable or asadhya. Another is Punabagandhi. Punabagandhi means when the blood has a smell like that of dead body. And Krishna Varna, when it is exceedingly black, when it get obstructed in the throat. And one more point is the Upadrava Sahidam, when the Rktpt is associated with all complications, it is Asadhyam. The complications are mentioned in Charaka Samhita Nidhanasthanam. Ubhadravastu khalu Daurbalya Arochaga Avipaka Shwasakasa Jwaradisara Shobha Shosha Pandaroga Swarabhedasha. So, if a case of Raktabita which is associated with these Ubhadravas, then we call it as Asadhya, or its prognosis is Asadhyam. And when a emaciated patient has continuous coughing and the phlegm that comes out yellow, blue, green or coppery in color, which is said to be Asadhyam. So prognosis, once again I will explain. Sadhyam urdhagam, yapyam to adhogadham, margo to dvavasadhyam. If it comes through the upper orifices and the lower orifices, then it is asadhyam. यथा तु सर्वचित्रेभ्यो रोमकूपेभ्य एव च वर्तते ताम् असङ्ख्येयं गतिः तस्याहुरान्तिकीम्. Sometimes the Rktpt moves through all the holes in the roots of hairs, which are innumerable, which comes through the roots of hairs, which are innumerable. Such a moment of disease certainly leads to death. Tasyahur Antikin. Yapyam, we already explained. Yapyam Dvidoshanugam is Yapyam. Ashtanga Hridayam Chikilsam explains as Adhogam Yabhayet. And Charaka Samhita, Shandam Shandam Pragupedi, Margan Margandaram Charet is also considered as Yapyam. When Rktpt comes through downward track, it is already described to be Yapyam. The shifting of the channel should therefore be interpreted here in the respect of upward track. So, Margan Margandaram Charet is interpreted in the respect of upward tracks. If it leaves one of the 7 channels and get manifested in another, then the disease becomes Yapyam. Note the point. Here in Charaka Samhita, it is explained that Margan Margandaram Charet is palliable or Yapyam. That means we already know the Adhogada Rktpt is Yapyam. Then what is Margan Margandaram Charet, which is described in the context of Urdhvagada Rktpt. Out of 7 channels, it leaves one channel and manifested in the another channel. Then the disease becomes palliable. Then Sadhya Raktapitam is Egamargam, Balavadaha, Na Adivegam, Navam, Sukhe Kale and Nirubhadravam. Ubhadravas we already discussed. If those Ubhadravas are absent or none of the Ubhadravas are there, then it is Sukhasadhyam and Sukhe Kale. Sukhe Kale means Hemanta and Shishira seasons. which is easy to control, or we can control the Pitika disorders. In Chikitsa Sthanam, there explains in the beginning, it explains again the prognosis, why the Urdhagata Raktapitam is Sadhyam. Why it is Sadhyam? Because next slide we will discuss the treatment. Pradimarge Haranam. That means Virachanam is the Ubakramam of Urdhagata Raktapitam. The movement of Raktapitta in upward direction and the treatment in opposite direction, that is Virachanam. And Bahu Aushadhatvat. So these 3 points make the Urdhagata Raktapitam Sadhyam. Then what about Adhogata Raktapitam? Adhogata Raktapitam, we know it is Yapyam. Why so? Because the treatment should be in opposite direction. So the treatment is Vamanam. Vamanam is not proper or the apt treatment for Pitika disorders, and Alpa Aushadhatvat Adhogata Raktapitam becomes Yapi. Ubhayam. Ubhayam is the bleeding occurs through upward and downward direction, which is asadhyam. Vamana, virejana, ayogitvat. We have to do opposite direction. The treatment should be in opposite direction. In such cases, how we can select a track? Because bleeding occurs through upward and downward direction. Then anaushadhatvat. These are the main points you have to study in the prognosis. Then next is treatment. In the case of Rktpt, Acharya Charaka explained treatment, a hint or giving a hint in the Nidhanasthana itself. Pradimargecha haranam Raktapitte vidhiyate. Pradimarge haranam, that means the treatment should be in opposite direction. If the cause of Rktpitta is Sandharpana and the patient is Akshina Balamamsaha, the stoppage of bleeding is not desirable. That is, I mentioned the question. Is stoppage of bleeding desirable? Stoppage of bleeding is not desirable in the case of Sandharpanajanya Raktapitam and in Akshina Balamamsaha. 2 types of Raktapitam are there based on the Nidana, Sandarpanodham and Apadarpanajanya. In Sandarpanajanya, next step we will check the Bala and strength and vitals of the patient. If it is stable and the patient is Akshina Balamamsaha, or he is having some strength and he is taking food, in such cases, there is no need to stop the bleeding. Sandarpanodham, Balavan, Bahudoshaha. We have to do Pradiloma Shodhanam in the case of Sandarpanajanya Raktapitam. Apadarpanajanya Raktapitam, Apadarpanodha Raktapitta in 2 types. That is in Urdhagata Raktapitta, we have to do Shamana Chikitsa, and in Adhogata Raktapitta, we have to do Brahmana Chikitsa. Suppose if the bleeding is stopped in the beginning, then it may cause. That means there is no need to stop bleeding in the beginning itself, and unknowingly we stop the bleeding in the beginning. Then it may cause Galagraham. Then it may cause Galagraham, Pudinasyam, Murcha, Aruji, Jwaram, Gulmam, Pliha, Anaham, Kilasam, Varnanasham, Bhagandaram, and Buddhi Indriya Ubarodham. If we stop the bleeding in the beginning, it will cause the diseases like Galagraham, Pudinasyam, Murcha, then GI tract disorders like Aruchi, Jwaram, Gulmam, Pliha, etc. So, what is the treatment? The first step is Lankhanam. The physician has to decide we have to do Lankhana or Tarpana. When we have to do Lankhanam or fasting, Amadoshat Sharirinam Vriddhim Prayadi Pittasrit Tasmad Lankhanamadidaha. Administer Lankhana or Tarpana in the beginning by considering the track through which the disease is manifested, the association of doshas, and the causative factors. So, if there is Amadosham in the beginning, then we have to do Lankhanam. Marge Doshanubandham cha Nidanam Prasamikshya cha. Lankhanam Rktpittado Tarpanam va Prayojyet. Lankhana or Tarpana by considering the associated doshas, considering the track through which the bleeding occurs, and the causative factors. That is what I mentioned in the earlier slides, Sandarpanodha and Apadarpanodha. So, in Urdhagada Rektabita, which I noted as URP, Urdhagada Rektabita, the treatment is Pradimarge Haranam Virechanam, then Tarpanam. In the case of Shamana Aushadis, we can choose Madhura Kashaya and Piktarasas. And in Adogada Rektapita, we have to do Vamanam, and after that, Peya. And as Madhura Aushadis can be given in Shamana section. Virejana, a drug of choice is Trivrit, Trivrit plus Abhaya, or we can give fruits of Aragvadam, Trayamana, Gavakshi, etc. Vamanam with Manda, prepared of Madanam and added with honey and sugar, along with additional sugar and water. And in Ashtanga Hridayam, I will explain the sloka in Ashtanga Hridayam. Sandarpanodham Balino Bahudoshasya Sathe Urdhvabhagam Virekena. Same thing is mentioned in Charaka Samhita also. Vamanena tu adogadam. Shamane Brahmanesha Anya Lengya Brahman Avekshacha. Urdham Pravritte Shamanau. In Urdhagada Rektapita Shamanam by Resau Piktakashayagau. Ubavasasya Nishundi Shadangodagapayinaha. Shadangodagam is explained in Jara Chikitsa. But here one difference is there. In Shadangam, Dhanachandana Shundyambu, you know the sloka I think. In that, Shundi is there in Shadangam. But in case of Rektavita, Shundi is avoided because it is Tikshna in property. So here Nishundi Shadangodagam is advised. Adoga Rektapite to Brahmano Maduro Rasaha. In Adoga Rektapita, we have to do Brahmanam by Madhura Rasam. Urduge Tarpanam Yojyam Peya Purvam Adogade. Urduge Tarpanam Yojyam Peya Purvam Adogade. Then Ashnado Balino Shuddham Nadharyam Tadhirogagrit. That I already explained. Then moving to the diet and drinks. While discussing the diet and drinks, if the patient is having pibasa, we can give Nishundi Shadangodagam and Srudashidam Toyam. Boiled and cold water is a good option for pipasa. In Urdhagada Rektavita, Tarpana is advised, and in Adogada, Peya. In the diet, first we have to give Peya. While giving Peya or Tarpana, consider the Kalam, Satmyam, Prakriti, etc. Tarpanam by Sagridha Kshaudram Lajachurneki. Lajachurna along with Gridam and Kshaudram. And if the patient is having Mandagni, we will assess the Agni of the patient. And suppose the patient is having Mandagni and he is Amla Satmyam, then Savar Tarpana by adding Dadimam and Amalagam. Savar Tarpana by adding Dadimam and Amalagam. And in the diet, we can include Shali, Shashtikam, Nivaram, Koradosham, then Shamyagam, Priyangu, etc. These should be used as food by a patient suffering from Rktpt. Mudga, Masura, Chanaga, and fruits of Adagi is also mentioned. Then in the category of leafy, in the vegetable section, we can suggest Padola is a good option and Nimba is a good option. Then leaves of Vedasa, Kiradatikta, then flowers of Kovidaram, Shalmali. Use by steam boiling or by frying in the ghee. Padola, Nimba, then Plaksham, leaves of Vedasa and Kiradatikta, etc. good options, but used by steam boiling or by frying with ghee. Meat soup also suggested in such cases. Kaboda, lava, shashamamsam, etc. It should be fried with ghee and added with sugar. Examples for gruels they are suggested there by adding extract of Kiradatikta, Ushira and Musta. And another example by adding extract of Harenuka. It will be easier to remember Harenuka, a single thread, than by adding ghee and extract of Bala. Gruels use after cooling and after adding honey and sugar. Elevation therapy or Shamana Chikitsa is suggested in Balamamsa Parikshinam. Suggested in case of Balamamsa Parikshinam. Balamamsa Parikshinam, Shogabhara Adhvakarshitam, Jwalanaditya Santaptir Anyerva Kshinamamayehi, Garbhini Staviram Kalam Ruksham Alpapramidashinam, Avamya Avirecham Va Yam Pashet Rektapittinam, Shoshena Sa Anubandham Va Tasya Samshamani Kriya. In Charaka Samhita, the slokas in 62, 63 and 64 explains to whom we have to do elevation therapy. Elevation therapy is useful for patients suffering from Rktpt in the following condition. Balamamsa Parikshinam. If there is loss of strength and for a patient, loss of strength and loss of muscle tissue. If the patient is emaciated because of grief, carrying heavy load and walking long distance. If the patient is afflicted with heat of fire of sun ray, that is Jwalanaditya Santaptam Anyerva Kshinamamayehi. If the patient is emaciated because of other diseases. If the patient is a pregnant lady and for old age or very young, in such cases also Shamana Chikitsa is good. If the patient is habituated with taking unctuous food or if he takes small quantity of food or for less number of times, in such cases also Shamana Chikitsa will be a better option. If the patient is not suitable for emesis or purgation, avamya avirechya, and if the patient is suffering from consumption, in such cases, the treatment should be Shamana Chikitsa or alleviation therapy. So we studied Shodhana Chikitsa and Shamana Chikitsa. First, you consider, is it a Sandarpanajanya, Sandarpanodha or Sandarpanajanya, and Abadarpanajanya or Abadarpanodha Rektapitam. Based on that, we will decide Shodhana or Shamana, and specific conditions of Shamana Chikitsa also explained. Then next is it Urdhagata Rektabita or Adhogata Rektabita? Based on the direction of bleeding, we will do the opposite direction of treatment. Pradimarge Haranam. That is, if it is Urdhagata Rektabita, treatment is Virejanam. If it is Adhogata Rektabita, treatment is Vamanam. Then next condition is Sakshaudram Kradide Rekte Lishyat Paravadam Shaprit. If blood is clotted, then the stool of Paravada with honey is suggested. Stool of Paravada with honey is suggested. Then few decoctions are mentioned, and after that Kshira Prayogam is suggested. Where we have to do the Kshira Prayogam? If does not get alleviated even after the administration of decoctions and by Agnidipti as well as alleviation of Kabha, we have to understand that Vayu is aggravated. In such cases, we will give Kshiras. Kashaya yogehi vividher yadhokter deepte anale. By giving the above mentioned kashayas, the kashayas like decoction of Shira, decoction of Padma, Utpala, etc. Pittahara Dravya Kashayas. And after giving those kashayas, Kashaya Yogehi Vividhehi Yadhoktehi Deepte Anale Kleshmani Nirjidecha. Even after the administration of decoction and by attaining Agnidipti as well as alleviation of Kabha, till the patient is having the problem, then yet Rektapitam Prashamam Nayadi. The disease Rektapitta is not subsiding. तत्र अनिलः स्यात् अनु तत्र कार्यं चागं पयः परमं प्रयोगे गव्यं श्रुतं panchagune jale cha. In such cases, chagam paya is the best option. And if you are giving gavyam payaha or cow's milk, then you should add 5 times water. Gavyam shrudam panchagune jale va. There are so many conditions explained in Rektavita. One among them is Mutra Margaka Rektavita. In Mutra Margaka Rektavita, we will suggest milk boiled with Shadavari and Gokshureka, or we can give Shalaparni, Prishniparni, Mashaparni and Mudgaparni immediately. It will stop bleeding. Shadavari Gokshuragehi Shrudam Va Shrudam Payo Va Atyada Parninibihi Riktam Nihantyashi Visheshadastu Yen Mutra Margat Sarucham Prayadi. In Mutra Margaga Rektavita. Then next is bleeding through anus. It's a very common condition, bleeding through anus, which will occur in Rectadisara and in Recta Arshas also. But here we will identify the disease only by the route through which it comes out. That means if the bleeding occurs through adhomargam, it is adhogada rektavitam, and if it is through anus, we can do rekta adhisara and rekta arshas chikitsa. And Gudamarge Visheshena Vasti. Specific treatment is Vasti in Gudamargaka Rektavitta. Other suggestions are milk boiled with mojarasam, milk boiled either Vadavaroha or Vadashunga. Then Vadavaroha means adventitious roots of Vada, or Vadashunga means leafy buds of Vada. Milk boiled with Kriberam, Nilolpalam and Nagaram. And after taking these Kshiras, you have to give Shali rice along with milk. Visheshado Vitpada Sambrate Payomadam Mojarasena Siddham Vadavaroker Vadashungakerva Kribera Nilodpala Nagharerva. Then, if there is excess bleeding, Charaka Samhita explains in such cases we can give Gridha, should be given in such cases. But in Ashtanga Hridayam, Jangala Rudiram with Kshaudram or Amam Aja Yakrit Pittayudham is mentioned. Ama Aja Yakrit Pittayudham. In Charaka Samhita, the drugs which will subside pitta, we can make it gridha and can be given to the patient. But in Ashtanga Hridayam, Vagbada explains Jangala Rudiram with Kshaudram or Amam Aja Yakrit Pittayudham. Then one of the main medicine explained in the context of Rktpt is Vashyagridham, and Vashya or Adathoda Vasika is the single drug which is used in Rktpt Chikitsa or which is the Agra Ushadam of Rktpitam. And in Ashtanga Hridayam Chikitsa Sthanam, there explains different forms of using Vashya. I will explain the prayogas of Vashya before Vashyagridham. Vashyarasena Bhalini Mridlodranchanamakshikam Pittasrikshamyet Pidam Niryasova Adarukshaka Sharkara Madhusamyuktaha Kevalova Srudobiva Vrishaha Sadhyo Jayatyasram Sahyasa Paramaushadam. Vashyarasena Bhalini Mrit Lodra Anchana Makshikam. In Vashya Swarasam, add Bhalini Mrit Lodra Anchanam Makshikam, etc. It is a very good medicine for Rektapitam. And Niryasova Adharukshakat. The Swarasam of Vashya leaves is very good in Rektapitam. And add sugar and madhu, honey in that. Then Srudobiva, the decoction of root of Vashya is very good. Vrishaha Sadhyo Jayatyastram Sahi Asya Paramaushadam, which is the main medicine for Rektavitam, Vashya. Then moving to Vashya Gridham or Vrisha Gridham. Samoola Mastakam Kshunnam Vrisham Ashtagune Ambase Paktva Ashtamsha Avasheshena Gridham Tena Vipachayet Tat Pushpagarbham Tat Sheetam Sakshaudram Pitta Shonidam Pitta Gulma Jara Shwasakasa Hridroga Kamala Timira Brahma Visarpa Swarasadhamsha Nashayet. While preparing Vrishagridham or Vashyagridham, the roots and leaves, the whole plant is used, and prepare the kashaya, and then prepare grida. Sorry. In that, the indications of Vrishagrida is Rektapittam, Pittagulmam, Jwaram, Shwasam, Kasam, Hridrogam, and Kamala. In Timira cases also, we can use this Vrishagridham. And another medicine is Sarpirguda mentioned in Urakshatam. And Shadavariyadi Grida is also a best choice of medicine. The external therapies mentioned in Raktapitta are Abhyangam, Parishegam, Segam, Avagaham, and Shidavidi, Shayanam, and Veshma. Next is Kanthamargika Raktapitam. In Kanthamargika Raktapitam, Utpala Nalaksharam is mentioned. It's the important section in Raktapitta Chikitsa. The Kshara Prayoga is mentioned in Kanthamargika Raktapitam. Utpala Nalaksharam with Madhu and surface in Kabhanubande, Kandagade, Gradite. In Ashtanga Hridayam Chikitsa, it is explained as Rekte, Sapiche, Sakabhe, Gradite, Kanthamargake, Lihyat, Makshika Sarpirbhyam, Ksharamulpala Nalajam. Utpala Nalaksharam was mentioned in Kanthamargaka Rektapitam. Next is Grana Margaka Rektabittam. Granage Rudire Shuddhe Navanam cha Anushechayet. In Nasagada Rektapitta, after attaining Shuddhi, we have to do Nasya Karmam with Kshiram plus Siddha or Kevala Jalam or Dadima Pushpaswarasam, Amrasti with or without Kshiram. These are the medicines which we are commonly using for Grana Margada Rektabittam. Kalpayet Shidavargam cha Pradeha Abhyanjanadishu Yacha Pitta Jware Proktam Bahirandasya Beshajam. In the earlier slide, I explained the external therapies. In external therapies, we have to use Shida Vargam or the drugs having Shida quality for Pradeha, Abhyanga, etc. And we can adopt the Pitta Jwara Chikitsa also. Hematemesis. While explaining the Kanthamargaga Rektapitta, it's an important point, hematemesis. As we all know, hematemesis is vomiting of red blood or coffee ground materials. It is the most common presentation of upper gastrointestinal bleeding. Melena develops after as little as 50 to 100 ml of blood loss in upper GIT bleeding. Hematochezia requires more than 1000 ml, suggest lower bleeding source. Upper gastrointestinal bleeding present with hematochezia in 10% of cases. It has a wide range of possible causes depending on the site of blood loss and the tissue that is actively bleeding. Indeed, patients with hematemesis can present in a number of clinical states. Uh, Causes are, one is esophageal causes like esophageal varices, Mallory Weiss tear. A Mallory Weiss tear is the most often caused from violent coughing or vomiting. Then erosive esophagitis and esophageal carcinoma. Diagnosis by liver function, bleeding time, urea and electrolyte, and hemoglobin concentration. The main is upper endoscopy, and we can assess the score by Glasgow Blatchford bleeding score. Glasgow Blatchford bleeding score or GBS is a screening tool to assess the likelihood that a person with an acute gastrointestinal bleeding will need to have medical intervention such as a blood transfusion or endoscopic intervention. In management, resuscitation, airway and oxygen, correct the floating abnormalities, then blood transfusion, monitor the patient, insert urinary catheter and monitor hourly urine output. If shocked, consider a CVP line to monitor the CVP and guide fluid replacement. Organize X-ray, ECG, then check the arterial blood gases in high-risk patients. Then arrange an urgent endoscopy. Endotracheal intubation frequently needed. Band ligation is a preferred method. And in Charakam Chikitsa Sthanam, in last sloka, it explained Rktpt is alleviated by seashore and bank of lakes, caves in Himalayas covered by snow, rising of moon, lotus pond. All these means the things which are pleasing or which are pleasing stories and pleasing surroundings can subside or alleviate pitta dosha. And in Ashtanga Hridayam, in the last sloka, there explained in Rakta Pitta, we can adopt Pitta Jwara Chikitsa. Similarly, Shatakshina Chikitsa also or Urakshata Chikitsa is also advised in Rakta Pittam. By this, I am winding up this session. Thank you.